to Dr. Dentico YouTube channel, and this is a continuation video of Impaction. So today we are going to cover radiological assessment of mandibular third molar. Okay, so today radiological assessment. So first we will cover WAR lines. Okay, what is the WAR? W-A-R, WAR lines. So for W we have white line, amber line and red line, right? So we will cover one by one. First we will going to cover white line. So what is white line? Occlusal, I mean teeth color is white, right? So we can remember like that occlusal is always white. So here we will draw one line which is passing from the occlusion of the first molar and second molar, right? So it is passing like this, and we have our third molar here. So what is the exact definition of white line? It is formed by joining occlusal surface of first molar and second molar, I mean molars, and extending it to posteriorly over third molar. Okay, we will extend it to posteriorly over third molar, right? So this is the exact definition of white line. So we will going to draw occlusal line and it will be extending towards the posterior over third molar. So what is the interpretation of this white line? What is the interpretation of this? So by this we can see a depth of impaction from occlusal plane, right? By this we can interpret this thing. Okay, so see here we can interpret this is our occlusal plane and this is the occlusal line of third molar. So this much is the depth from the occlusal plane, right? Then we have amber line. So what is amber line? We have to draw a line from interdental septum which is present between two molars, and from this we will extend it to the posteriorly over the third molar. So what is the exact definition of amber line? It is formed by joining the bone overlying mandibular third molar with interdental bone, right? With interdental bone septum between first and second molar, right? So we will draw line from here and it is on the interdental bone septum. Okay, interdental septum. So what is the interpretation for this? The interpretation for this is depth of interpretation is depth of impaction within the bone. Okay, impaction within bone. So see here we have our this much is our bone depth, right? In this we will see occlusally depth from occlusion and here depth from bone, right? Then third line which is a red line. Red sign indicates a danger. Okay, so first we will define this red line. It is defined as it is formed by drawing a perpendicular line from amber line to point of application of elevator. So what is this? So first you should know what is the point of application of elevator. Okay, where should we place first elevator while removing a third molar, impacted third molar? So point of application of elevator is, it is two different for different impaction. So first is our mesial mesoangular. First is our mesoangular. Okay, 1 second. First is our mesoangular, and vertical. It can be mesoangular, vertical or horizontal. Okay, for this type of angle we will place elevator mesial to CEJ. Okay, we will place mesial to CEJ, and for distoangular we will going to place elevator distal to CEJ. Okay, so see here, this is our mesoangular, right? So we will going to place elevator mesial to CEJ. Okay, this is a mesial side of CEJ. So it is like this. If it is distoangular, we have to place elevator like this on distally, right? So we will place like this. Now, what is the interpretation of this red line? So by this, what we can interpret, that it denotes the depth of, let me write, interpretation. It is denotes depth of impaction. It is denotes depth of impaction with reference to amber line. Okay, with reference to amber line. So first with the reference of occlusal plane. Second, amber line was with the reference of bone, right? And third is with reference of amber line. Okay, so this red line should be what we say, yes, here you can see this is the depth, right? So by this, if this depth is 5 mm, then it is okay. It is easy to remove, but not that much easy, but it is easy to remove, like itna to chalta hai. But if it is more than if it is more than 5 mm, then it is very difficult, and sometimes we require general anesthesia for patient also. Okay, and if it is more than or equal to 9 mm, then it is, we can say it is very deep seated, right? That's why it is that much deep. Okay, so it is very deep seated, and it is a near to root apex of second molar. Okay, so we can say this red line, it denotes our difficulty. So how much difficult it is there? If till 5 mm it is okay, but after 5 mm, if 1 mm is also increasing, it directly difficulty is increasing by 3 times. Suppose in 5 mm we have x difficulty, but if it is 6 mm, then we have a 3x difficulty. Okay, then it will increase by 3 times. Okay, so this was about our VAR lines. Then second we have our WHARFE assessment. Okay, second what we have, WHARFE assessment. Okay, so in WHARFE assessment we have a, what is WHARFE first? It is W for Winter's classification, then H for height of mandible, A is angulation of third molar, R is root shape and development, F is follicular size, and E is equal to exit path. Okay, so first, what is Winter's classification? We already have covered in previous videos. Winter classification is nothing but that 6 types of classification which was given by Winter, that mesoangular, distoangular, vertical, horizontal, inverted, and which one left? Yes, lingually rotated, right? So this was classification which is Winter's classification, right? So by this, what is vertical? By this we will denote the difficulty criteria. Okay, so in Winter's classification, if tooth is vertical, if tooth is vertical, then it is easy to remove. That's why its difficulty index is 0. Then if it is mesoangular, it is 1. If it is distoangular, it is 2, and also for horizontal it is a 2. Okay, For this we have to remove we can say very less bone, and for this we have to remove some amount of bone, right? Then height of mandible, same reason, whatever depth of impacted third molar is there, right? So जितना वो डीप सीटेड होगी उतना हमको बोन ज़्यादा रिमूव करना पड़ेगा, राइट? दैट्स वाई हाइट ऑफ मैंडिबल इज इम्पोर्टेंट. एंड अदर देन दिस, इफ इट हाइट इज वेरी लेस, so we can say fracture chances are there, right? So for this reason we have to see a height of mandible. Okay, so how we will going to measure height of mandible? We will measure it from interdental septum of first and second molar, it means 7 and 8, to lower border. Okay, to lower border. From this we can measure a height of mandible. So if it is 1 to 30 mm, then difficulty index is 0. If it is 30 to 33 to 34, it is 1. If it is 35 to 39, it is 2. Okay, and then we will move towards the angulation of third molar. Okay, in this what we can see, if tooth is like placed, we can say this is our second molar, right? And if tooth is placing like this mesoangular, then if we make a angle here, we can see it is a angle, right? This is going to be angle. So this is nothing but 60 degree, almost 60 degree. Okay, so this one is the acute angle. Now if it is a distoangular molar, then this angle will be going to be a obtuse angle. Okay, this is going to be a obtuse angle. So in this difficulty we have more difficulty, for this we have a less difficulty. Okay, so 1 to 59 degree, 0 degree, 0 difficulty is 60 to 69 1, 70 to 79 2, 80 to 89 3, but exact 90 degree we have a 4. Okay, now move towards the next, which is our root shape. Okay, next is our root shape. So in root shape, 3, one is complex, one is favorable curvature, and another one is unfavorable curvature. So what is importance of root shape? If it is complex, okay, complex means what? Roots are fused. Okay, like this. This is a fused root. Okay, so whenever we are going to remove this third molar, we can easily remove it out because it is all fused root. Okay, so less chances of breakage of root is there, right? So it is a very easy. So it is 1. If it is separated like this, okay, in this condition there are chances, we are removing like this. Okay, so there are chances of fracture of this end of apex root. Okay, that's why it is more difficult. Then favorable curvature and unfavorable curvature. What is curvature? Now suppose I have one tooth and curvature of this is like this. So whenever I am going to remove this, it will easily remove, right? It is our favorable curvature because we are removing it from labial side, right? Then another one is the unfavorable curvature. In unfavorable curvature, the curvature is like this. So it is more difficult to remove. Okay, so this was about the root shape. Then second is our follicular size. In follicular size, if it is normal, then 0, possible enlarge 1, enlarge 2. Now see, suppose this is our mandible, this is our second molar, and we have a third molar. A third molar is something like this much is impacted. So here no space for follicles, right? So there is very less amount of less measurement of follicle is present there, right? So very less dimension. So it is normal. So we have a 0. And if it is थोड़ी भी अगर deep seated होगी, then we have a possible size of what we say follicle is there. So it is possibly enlarged. And if it is very deep seated or it can be horizontal, then in this we have a very large size of follicle. That's why it is index is 2. Okay, then third one is our exit path. So what is an exit path? We already covered this classification based on Remus relationship. If you remember, we have like this mandible, and here we have second molar, right, first molar, and here we have third molar. So we have classified like this as an anterior border of ramus and distal border of second molar. If this much space is available, then tooth can erupt. Okay, and we have covered this classification also, like class 1, class 2, class 3, no space, space, and all this. If there is space available, it will good for us to remove, right, because we have space, so it is 0. Now if distal cusp is covered like this was a case. Here ascending border is like this, and this is our second molar, right? Now in this cases we have no spaces available, right? So in this it is very difficult to remove. Then distal cusp covered. What is meaning of distal cusp covered? So we have like this second molar, but mesial cusp is already erupted, okay, partially impacted was there. Now distal cusp is still covered, so we have to remove that much amount of bone to come out to expose distal cusp, and then we will remove. So distal cusp is covered, it is 1. Same like this, if mesial is covered, it is 2, and both are covered, then it will be going to 3, right? So this was about a WHARFE assessment. So we have covered 2 radiological assessment like WAR lines and WHARFE assessment, and we have remaining till our difficulty index for third molar, in which Winter's classification, difficulty index, and Bellen-Gagry, and also one is there like Pedersen difficulty index, and all this thing we have remaining. So in next video lecture I will going to cover this, and then we will move towards a treatment part. Okay, so thank you so much. If you like this video or if you have any doubt, please comment me down, and please make it share, subscribe, and like, please. Okay, thank you so much. If you have any doubt and you want to any topic from me, you can comment me or you can DM me on Instagram. Okay, you know my Instagram ID, and it is Dr.Dentico by Dr. Devyani. Okay.